every 40 seconds someone in the world has a heart attack. Every 40 seconds. And the most frightening part of all, most of these people felt something was wrong before it happened and ignored it. They thought it would pass. They thought it wasn't serious enough. They waited, and for many of them that wait cost everything. I'm Dr. Andrew Senemies, and in the next few minutes I'm going to walk you through the 7 symptoms of a heart attack that you should never, under any circumstances, ignore. Stay with me until the end, because any one of these symptoms could be happening to you or someone you love right now. And knowing what they mean could be the difference between life and death. Let's start with something that might surprise you. Heart attacks are not just a man's problem. They are one of the leading causes of death worldwide in both men and women. And one of the most dangerous statistics I can share with you is this: up to 40% of deaths from heart attacks happen before the person ever reaches a hospital. That means nearly half of the people who die from a heart attack never even got the chance to be treated. They either didn't recognize what was happening, or they waited too long to act. On the other hand, patients who arrive at the hospital quickly, who receive treatment in time, have dramatically better outcomes. The heart responds well to treatment when it gets there in time. So what we're talking about today is not just medical education, it's survival knowledge. The medical term for a heart attack is acute myocardial infarction, and it belongs to a group of conditions called acute coronary syndrome, which affects the coronary arteries, the arteries responsible for supplying blood and oxygen to the heart muscle itself. When one of these arteries gets blocked, the heart muscle begins to die from lack of oxygen. So time is muscle, as we say in cardiology. Every minute without blood flow means more heart tissue lost, and that's exactly why recognizing these symptoms early is so critical. Let's talk about the first symptom, and the one most people are familiar with, chest pain. Now, when most people imagine a heart attack, they picture someone clutching their chest dramatically and collapsing, and yes, that can happen. The classic presentation is an intense, oppressive, crushing pain in the center of the chest. What we call precordial pain, because it's located in the area right over the heart. This pain often radiates outward. It travels to the left arm, to the left shoulder, up into the jaw. In some cases it can even travel down into the abdomen. And when the pain is that intense, most people already suspect something is seriously wrong with their heart. But here is where it gets dangerous. The pain doesn't always feel like that. In many cases, especially in women, in elderly patients, and in people with diabetes, the chest pain can be subtle. It might start as a mild discomfort, slight pressure, a heaviness sitting in the middle of your chest, a burning sensation that you might mistake for acid reflux or indigestion. And because it's not dramatic, people wait, they take an antacid, they lie down, they hope it passes. What you need to pay attention to is the nature and the duration of that discomfort. Chest pain from a heart attack doesn't usually last just a few seconds. It's not a sharp pinprick that comes and goes instantly. It doesn't change when you shift your position. It doesn't matter if you're lying down, sitting, standing, or moving, the pain stays. It typically lasts at least 5 minutes and often much longer, and sometimes it will ease off and then return. That pattern of coming and going, but not completely disappearing, is a major warning sign. And if you're over 45 years old, if you have high blood pressure, if you smoke, if you have elevated cholesterol, or if there's a family history of heart disease in your family, your level of suspicion for any chest discomfort should be very high. Now let's move to the second symptom, and this one is where a lot of people get blindsided. Pain or discomfort in other parts of the upper body without necessarily having significant chest pain. And this is critical to understand. A heart attack doesn't always announce itself with chest pain. Sometimes the only symptoms are elsewhere in the body, and the person has no idea their heart is in danger. And this could feel like numbness or tingling in the left arm, or even both arms. It could be an unusual sensation in one of your hands, and it could feel like discomfort in the stomach, similar to indigestion or a stomach ache. It could be pain in the back, tension in the neck, or an aching feeling in the jaw that seems to have no dental explanation. These symptoms can appear in any combination and in any order. And a person might start complaining about jaw pain or back tension and never mention anything about their chest. And meanwhile, their heart is in crisis. And this is why risk factors matter so much. If you're a person with high blood pressure, elevated cholesterol, diabetes, a history of smoking, or a family history of heart disease, you need to treat these unusual symptoms with a completely different level of seriousness than someone who has none of those factors. Your body might be telling you something your mind isn't ready to accept. And the third symptom is cold sweats. And I want you to picture this clearly so you can recognize it when it happens. The person is not exercising, they haven't been out in the heat, there's no obvious physical reason for it, and yet suddenly they begin to sweat. Their skin becomes clammy and cold to the touch, and their colour changes. They look pale, almost grey. So this is the body's emergency response system activating. The nervous system is reacting to the stress the heart is under, causing blood vessels near the skin to constrict and redirecting blood to the vital organs. And the result is that characteristic cold, clammy, pale appearance that emergency responders are trained to look for. If you see someone, or if you yourself suddenly look pale and sweaty for no obvious reason, especially if it's accompanied by any of the chest discomfort or arm sensations we just discussed, that combination is extremely alarming. Do not sit down and wait to see if it passes. Treat it as an emergency. The fourth symptom is nausea and vomiting. The heart and the stomach share some of the same nerve pathways. And when the heart is in distress, it can trigger a strong sensation of stomach discomfort. So the person may feel intensely nauseous, they may feel like they need to vomit, and in some cases they do. This is one of the most commonly misinterpreted symptoms of a heart attack because it mimics food poisoning, stomach flu, or simple indigestion so closely. People lie down, they take medication for nausea, and they wait, not realizing that their heart is the source of the problem. If nausea or vomiting appears, vomiting alongside cold sweats, arm discomfort, or any kind of chest pressure, even mild, please do not attribute it to something you ate. The context matters enormously. A healthy 25-year-old who just ate street food and feels nauseous is probably fine. A 55-year-old with high blood pressure and high cholesterol who suddenly feels nauseous and sweaty while sitting still is in a very different situation. Know the difference. The fifth symptom is dizziness. The person feels a sensation of vertigo, like the room is moving or spinning slightly, and they feel unstable on their feet. Walking feels difficult. They might reach for a wall or sit down because they feel like they might fall. And this happens for a very specific reason. When the heart begins to fail during a heart attack, it loses its ability to pump blood efficiently. When less blood reaches the brain responds immediately. It produces dizziness, lightheadedness, visual disturbances, and that overwhelming sense of instability. On its own, dizziness can have dozens of explanations: dehydration, inner ear problems, low blood pressure, anemia. But when dizziness appears suddenly alongside other symptoms from this list, especially in a person with cardiovascular risk factors, it needs to be taken seriously and evaluated immediately. The sixth symptom is shortness of breath, what we call dyspnea in medical terms. This is a feeling that you simply cannot get enough air into your lungs, even when you're at rest, even when you haven't been doing anything physically demanding. You breathe in, but it doesn't feel like enough. You might find yourself needing to breathe faster or deeper just to feel slightly comfortable. Some people describe it as if someone is sitting on their chest, making it hard to expand. This happens because when the heart muscle is damaged and its pumping function is compromised, blood backs up. less blood flows efficiently through the lungs, oxygen exchange becomes less effective, and the body starts signaling desperately that something is wrong. And importantly, this symptom can appear with or without chest pain. And some people have a heart attack, and the only sensation they describe is this inability to breathe properly. It can also be triggered or worsened if an arrhythmia, an irregular heartbeat, develops as a consequence of the heart being under stress. When the heart beats irregularly, even less blood reaches the brain and lungs, which can worsen both the dizziness and the breathlessness simultaneously. And then there is the seventh symptom, perhaps the least talked about, the most underestimated, and in many ways the most fascinating from a medical perspective: anxiety or an unexplained sense of dread. So patients often describe it as a feeling that something terrible is about to happen, but they can't explain why. And they feel a general unease, a deep discomfort that doesn't have a rational source. And some people become unusually irritable or emotionally unstable. They might cry suddenly without knowing why. Some people describe what feels exactly like a panic attack. Racing thoughts, fear, a sense that something is profoundly wrong. And here's what's remarkable about this symptom. The body knows before the mind does. The nervous system detects the physiological crisis happening in the heart and sends signals that manifest as this overwhelming psychological distress. Many people who experience this dismiss it as anxiety, as stress, as being overworked or overtired, and in many cases that's exactly what it is. But in a person with cardiovascular risk factors, especially when this anxiety appears alongside even one other symptom from this list, it cannot be ignored. Now, I want to spend a moment talking about cardiovascular risk factors because understanding them is what gives all of these symptoms their true significance. A single symptom in isolation might mean many things. But a single symptom in a person with multiple risk factors means something very specific, very urgent. Age is one of the most important factors. In men, cardiovascular risk begins to rise significantly from the age of 45. In women, the increase typically begins around 55. Because estrogen provides a degree of protection to the cardiovascular system up until menopause. And after menopause, as estrogen levels drop, women's cardiovascular risk rises to match and in some cases exceed that of men. This is why it's so important that women do not underestimate their own risk or assume that heart attacks are primarily a male condition. High blood pressure, hypertension is one of the most damaging and most common risk factors. It puts constant excessive pressure on the walls of the arteries, damaging them over time and making them far more susceptible to blockages. If you have high blood pressure and it's not being treated or controlled, your risk is significantly elevated. Cholesterol levels matter enormously, high LDL. Cholesterol, the so-called bad cholesterol, is directly involved in the formation of arterial plaques, the build-ups inside artery walls that can eventually rupture and cause a heart attack. High triglycerides and low HDL, the good cholesterol, also contribute to this risk. Having your lipid panel checked regularly and managing these levels with lifestyle changes or medication when necessary is a fundamental part of cardiovascular prevention. Smoking is one of the most powerful risk factors there is. It damages the inner lining of blood vessels, accelerates the build-up of plaque, increases blood pressure, and makes the blood more likely to clot. If you smoke, your risk of a heart attack is dramatically higher than a non-smoker. And the good news is that this is a risk factor entirely within your control. Obesity, type 2 diabetes, and a sedentary lifestyle are deeply interconnected risk factors. Excess weight contributes to high blood pressure, elevated cholesterol, and insulin resistance that leads to diabetes. Diabetes in turn damages both the nerves and the blood vessels in ways that increase cardiovascular risk substantially. And because diabetes can affect the nerves that carry pain signals, diabetic patients sometimes experience what we call silent heart attacks with very few or no classic symptoms, making them particularly dangerous. A sedentary lifestyle amplifies all of these risks and is independently associated with worse cardiovascular outcomes. Family history is a risk factor you cannot change, but you absolutely need to know. If your father or a brother had a heart attack before the age of 55, or if your mother or a sister had one before the age of 65, your risk is significantly elevated. This doesn't mean a heart attack is inevitable. It means you need to be more vigilant, more proactive about prevention, and more responsive when symptoms appear. Chronic stress and poor sleep are increasingly recognized as genuine cardiovascular risk factors. Living in a state of constant psychological stress with chronically elevated cortisol levels contributes to inflammation in the arteries, raises blood pressure, disrupts sleep, and often leads to other behaviors like poor eating, inactivity, and smoking that compound the risk further. If you are someone who is chronically stressed, sleeping poorly, and feeling emotionally depleted, this is not just a quality of life issue. It is a cardiovascular issue. And finally, stimulant drugs, particularly cocaine and amphetamines, can trigger something called coronary vasospasm, a sudden severe contraction of the coronary arteries that cuts off blood flow to the heart. And this can cause a heart attack in people who are otherwise young and apparently healthy, sometimes even in people under 40. And this is one of the reasons why heart attacks in young people, while less common, are not rare, and why drug use is a serious cardiovascular risk factor that often doesn't receive enough attention. Now, what should you actually do if you or someone near you begins experiencing these symptoms? First and most importantly, do not wait. Do not sit and observe. Do not drive yourself to the hospital and hope for the best. Call emergency services immediately. In the world of cardiology, we talk about the golden hour, the first 60 minutes after symptoms begin, as the window in which intervention has the highest chance of saving the heart muscle and the person's life. The mortality risk is highest in this first hour, particularly because of the risk of life-threatening arrhythmias. Getting to a hospital quickly is not an overreaction. It is the correct and appropriate response to what could be a life-threatening emergency. And when help arrives, or when you reach the hospital, provide as much information as possible. Describe the symptoms clearly. When they started, how they feel, whether they've changed, share your full medical history, the medications you're currently taking, and any allergies. If you have a previous electrocardiogram, an EKG from a prior checkup, bring it or have a photo of it on your phone. Comparing a current EKG with a previous one can be tremendously valuable for doctors in quickly assessing whether something has changed in your heart's electrical pattern. And beyond the emergency response, there is the question of prevention, both for people who have never had a heart attack and for those who have already survived one and want to ensure it doesn't happen again. The controllable risk factors are your targets. Quit smoking if you smoke, manage your blood pressure, keep your cholesterol and triglycerides in healthy ranges. Control your weight, exercise regularly. Physical activity is one of the most powerful tools for cardiovascular health that exists. Manage your diabetes, if you have it, reduce chronic stress wherever possible, sleep adequately, and avoid stimulant drugs entirely. Visiting your doctor regularly for checkups, having your blood pressure, cholesterol and blood sugar measured, and discussing your family history. These are not optional activities for someone who cares about their heart, and they are the foundation of cardiovascular health. And if you have been experiencing chest discomfort during physical exertion, or when you're exposed to cold, or in emotionally stressful situations, even if it passes quickly, please tell your doctor. These could be signs of angina, which is a condition where the heart isn't getting quite enough oxygen during periods of higher demand. It's not yet a heart attack, but it can be a warning that one is coming, and it can begin years before an actual infarction. A stress test and other evaluations can help identify whether there is a problem, and treating it early is infinitely better than waiting until there's a crisis. Your heart is working every second of every day without rest, without pause. It deserves your attention. It deserves your care. And the symptoms I've described today, chest pain or discomfort, pain in the upper body, cold sweats, nausea and vomiting, dizziness, shortness of breath, and unexplained anxiety, are the heart's way of asking for help, of telling you that something is wrong. Please listen to it. Please don't rationalize it away. Please don't wait for it to pass. Share this video with the people you love, with your parents, your siblings, your friends. Because the person who most needs to hear this information is often the one who would never search for it on their own. I'm Dr. Andrew Sinemis. Take care of your heart, and I'll see you in the next video.